All right, in this video, we are going to learn about forensic toxicology. So, as an introduction to forensic toxicology is the study of poisons or the detection of foreign substances in the body that can have a toxic effect. And these include things like alcohol, industrial chemicals, poisonous gases, illegal drugs, and drug overdoses. Now, this can be used in different places. One most often is post-mortem. So if somebody has died, the medical examiner or the coroner will look at the body and try to determine if there were drugs in the system or a drug overdose could have caused the death. It is used in criminal cases such as motor vehicle accidents, assaults, trying to see if somebody was under the influence, workplace drug testing, right? Many jobs require you to get drug tested before you work there or during your work time. And then sports is also commonly with performance enhancing drugs. Now, we're obviously going to focus on, the forensics. So going to a crime scene and trying to figure out what had happened and if drugs or alcohol were involved. So, speaking of that, toxicologists would be somebody who detects and identifies drugs and poisons in the body. It could be in their fluids, their tissues, their organs. They can identify a drug overdose or monitor the intake of drugs. They work in different areas such as crime laboratories, medical examiners' offices, hospital laboratories, and other health facilities. They can measure the amount of alcohol or other abused drugs in the body for violations of criminal law. So let's look at drugs and how they are defined and how they have been playing out in history. So the definition of a drug is a natural or synthetic substance designed to affect the subject psychologically or physiologically. So when we talk about controlled substances, or you hear that word, these are drugs that are restricted by law. And in fact, there was a Controlled Substances Act that was enacted in 1970 that lists illegal drugs, their category, and their penalty for possession, sale, or use. So there are many drugs out there. Some you can get over the counter, such as aspirin, but there are other illegal drugs. And we can actually take a look at some classes of drugs to see what kind of effect they have. So one example is a stimulant. It enhances the function or activity of the brain. It causes alertness and motivation. Another type of drug is a depressant. It helps to relieve anxiety and muscle spasm. It causes sedation and confusion. We have drugs that are known as hallucinogens. They cause subjective changes in perception, thought, emotion, and consciousness. And we have drugs known as narcotics. They help slow physical activity, analgesia, and cause drowsiness. Okay, so drugs can be one of these types, but they can also fall into multiple categories. What we have here is called the drug schedule. So not all drugs are the same. Some are more lethal than others. Some are more addictive than others. Okay? Drugs that are in Schedule 1 include things like heroin, LSD, ecstasy, GHB, and they have high potential for abuse and addiction, and there is no medical value. As we go down the schedule, you could see we encounter some drugs in Schedule 2, for example, cocaine or methamphetamines. In Schedule 3, we have drugs like Vicodin or codeine, commonly used in surgeries or post-surgeries. Schedule 4, we have Valium, Xanax, Rohypnol. Schedule 5, we have antitussive, antidiarrheal, or analgesic medicines. These, the Schedule 5 have low potential of abuse, and they are accepted for medical use, and they are quite common. Okay, so all of these drugs are in different schedules based on their medical use and their potential for addiction and abuse. One of the things you might have heard of is a therapeutic ratio, which is how much of the drug is beneficial, is therapeutic, versus how much is actually lethal, which can actually kill you. And we can see at the bottom of this graphic, drugs like heroin and GHB, you only need to take a little bit before you can start to become addicted to that drug. Okay, but we also see drugs in the middle like codeine and cocaine. And then up at the top, we see drugs like caffeine, aspirin, LSD, cannabis. Okay, all of these drugs have some sort of addiction potential, and some are obviously more lethal than others. Now, when somebody is trying to figure out what kind of drug was taken or was in the body, okay, there's two types of tests that can be used. There are presumptive tests or screening tests. These are different color tests, for example, that we're going to talk about in a bit, that can just identify a drug, but then we need what's called a confirmation test to actually look at the structure of that drug to actually be able to identify it specifically. And those confirmation tests include things like chromatography, spectrophotometry, and mass spectrometry. So speaking of those tests, we can go back to our different types of evidence. So a presumptive or a screening test would be class. Okay, it can be used to determine that it is a drug and maybe identify the drug, but then we need an individual evidence like chromatography or mass spectrometry to specifically identify the drug or the poison and its components. So speaking of those presumptive color tests, we have different tests that are done in the lab to determine what kind of drug it is. And for example, we can test for amphetamines and barbiturates using these two specific tests. And then here's some other tests where we can test for marijuana or we can test for cocaine. Okay, here's an example of chromatography as a confirmation test. It's a technique used for separating mixtures into their component compounds. So you have a mobile phase and a stationary phase, and as it moves, we can then look at our test sample to determine if, for example, it was cocaine or lidocaine or caffeine, okay, depending upon how much the sample moved during the experiment. So where do we collect samples for these drug tests? Well, there's three common ways. One is taking somebody's blood. We can, in number 2, take a sample of urine. And in number 3, in some cases, you can take a sample of somebody's hair. Now, interestingly, when we talk about hair, because we know that hair grows at a certain rate per month, we can test a sample of hair to see whether the drug was present some months, but maybe not others. And then when we talk about blood, some drugs stay in the body longer than others. For example, something like heroin and alcohol only stay in the blood for about 12 hours, but something like cannabis stays in for 336 hours on average. Now, this next little part is going to talk about alcohol and what kind of effect that has. So here's some statistics for you to consider. Nearly 17,500 automobile deaths occur in the U.S. every year, and 40% of all auto fatalities are due to alcohol. It is the most abused drug. Therefore, we have to be able to test rapidly and accurately due to legal needs. And in order to figure out whether somebody has consumed alcohol and whether they're over the legal limit, we measure what's known as the BAC, the blood alcohol content. It is expressed as a percent. So you know that the legal limit in most states is 0.08, and there are some parameters that affect somebody's BAC, such as their body weight, their alcoholic content, how much did they drink, okay, when they were drinking, the number of beverages consumed, and then the time between consumption. So as we know, somebody who drinks a lot in a short amount of time is going to have a higher BAC over somebody who drinks over a couple of hours. But also you have somebody's body weight that also plays a big role. Whether somebody had food while they were intaking alcohol. Now, we know that alcohol has many effects on a person, and we can note here on this slide, that 0.08 is that the legal limit. Okay, there's an impairment in your coordination of judgment. Below that 0.08, you start to feel less coordinated, less inhibited, less alert, and then after that 0.08, if you've had a lot of alcohol, the more you drink, the more impaired you become, the less alert you are. In fact, if you drink too much, you could lose consciousness, and some may die. And of course, the biggest thing when it comes to, alcohol is driving, right? You should never drink while driving, okay? Or, should never drive after drinking, because even with a, 0.01 or 0.02 BAC, you're losing that alertness, you're losing that attention, okay? You're losing your coordination as you increase, and you never want to put yourself in that position. So how do we actually test for somebody's BAC? Well, one of the simplest ways is a breath tester or a breath analyzer. So they are used to analyze your breath, and you breathe into the analyzer, and the fuel cell will that's inside the analyzer will be able to capture the breath and then analyze it to determine what level you are at. Additionally, you can test using preliminary tests that is used to determine the degree of somebody's physical impairment and whether or not another test is justified. And there are psychophysical tests, 3 common ones that you might have seen if you've ever seen any cop shows. So you can test somebody's eyes, okay, to see whether they are tracking or not. You can have what's called a 9-step walk and turn, see if you can step one in front of the other. And then a third possible step is a 1-leg stand to see if you can maintain your balance and follow instructions. So these are all tests that a cop would do to see whether you are driving drunk or not.